Carpal tunnel syndrome is the most common compressive neuropathy that affects the hand. It can affect any age, but more commonly fourth or fifth decade. The most common presentation is usually patients will complain of numbness and tingling to the tips of their thumb, index, and long finger. Usually this wakes them up at night. They'll have a complaint that their hand feels like it's on fire. They have to get up, shake the hand, they go back to sleep, then it wakes them up again. That's the most common complaint. It's usually sleep disturbance, but also patients will complain that their hand falls asleep when they're driving, if they're writing on the computer, holding a book, difficulty holding the cell phone. There could be some weakness or clumsiness with it. Occasionally there is some pain. The diagnosis is confirmed by history and physical exam, and final confirmation is made with a nerve test. Depending on how long the patient's had the symptoms and the severity of the nerve test determines what treatment will be rendered. In more mild to moderate cases, usually the use of a wrist support at night with sleep and avoidance of some exacerbating activities may be enough to handle the symptoms for a period of time. But usually, as time goes on, the majority of these patients need to have surgery to have their nerve released. This surgery is extremely effective in eliminating the symptoms that wake the patient up at night, and also very effective in reducing and or eliminating the symptoms that are bothering them in the daytime. Recurrence after carpal tunnel release is extremely rare, and it's probably one of the most gratifying operations I do in my practice.